Hi, Tony. Welcome, everybody. I'm Lori Dorfman from Berkeley Media Studies Group. Welcome to Public Health Awakens' first Facebook Live event. We're very excited about this. We hope you are too. I'm welcoming Dr. Tony Iton from the California Endowment. I want to thank the California Endowment for hosting this and sponsoring it. And I also want to remind anyone who's viewing that you can submit questions to this conversation we're going to have about taxes and public health. And you can submit questions, and you can also join Public Health Awaken and also join us in a thunderclap immediately following this, where we will have a hashtag taxes make health happen. So Tony, you got the message. We're talking about taxes today. We're doing it today because it's tax day, as everyone knows.
Happy tax day.
Yeah, happy tax day. Well, that's just it. I think it should be a happy tax day. I think public health should be celebrating tax day. And I have a lot of reasons for this. And I thought that you might share my enthusiasm for this. So that's why we wanted to have a conversation with you. And part of that is based in what we think public health is, of course. And, you know, when I was coming up in public health, the World Health Organization told the world that public health was more than just the absence of disease. And then when I was learning public health, and now it's very common to hear people talk about the social determinants of health. So in a second, I'm going to ask you what that means to you. And then I'm going to ask you after that, what taxes have to do with it. And then the last thing I'm going to ask you is why it's important that in public health, we think about taxes this way and we talk about taxes this way. So start first by just telling us how you think about social determinants of health, because that's jargon we use together, but we need to be able to explain it to people who aren't in our circle. What does it mean to you?
Yeah, Lori, it's one of those terms that I think is really critical, but it is very jargony. Let me start by saying that, you know, we know from public health research that 80+% of what affects how long you live and your health status happens outside the doctor's office. And in that 80+%, there's a lot of stuff in our lives, in our environments, in the way that we navigate the world. And the easiest way for me to explain it is to talk about how I first confronted it. When I got to medical school in Baltimore, Maryland, and saw the conditions in East Baltimore immediately around Johns Hopkins Medical School. And those conditions were really quite shocking to me. The housing was blighted. People had no jobs. There were no sources of healthy food, fast food, liquor stores all over the place, no parks, broken sidewalks, litter and clutter throughout the streets. And those are the environmental conditions, environment defined broadly, that shape particularly young people's way of navigating the world. And when you feel basically challenged on every meaningful front in your life, not being able to find good housing, not being able to find good schools, not being able to find healthy food, not being able to get potable water in many instances, it gets under your skin and it changes your physiology. So we think that there's a lot that we can do in the policy domain to actually reduce the stress in people's lives so that they actually have healthier lives. And so that 80% of what shapes your health status outside the doctor's office, those are essentially the social determinants of health.
So they're determining your health, and they have social roots and social causes.
Exactly.
Okay. So that makes a lot of sense to me, obviously. You knew I agreed with that. So now tell me, what do taxes have to do with that? In public health, we drive in a lane that's pretty narrow sometimes, even though all those things you described are pretty broad. And when we talk about taxes on tax day, we're getting sort of the most broad. What's the connection for you in how taxes can help us improve the social determinants of health?
Well, taxes are really a statement of our values, our collective values as a society. So what we say matters, we express by funding it. And I think one of the big challenges that we fail to recognize often in public health and in the larger society is that taxes are really an investment. They're an investment in the well-being of our future generations. They're an investment in our own well-being. And if we think about what are those things we need to invest in our society, those are the things that we should be eager to support with taxes. Too often we think of taxes as expenditures, things I have to pay, the government's coming after me to collect my share of something that I don't even support. And I think we have to flip our understanding of what we use taxes for. I'll tell you, in our research, we found that prevention polls very well. People really like prevention, and taxes are really our investment in prevention.
That's great. Taxes are our investment in prevention. And they can be very specific, of course. You know, today is the day people are paying income tax, but we have a lot of different taxes that we pay. And there's interesting research as well that shows that if you just say taxes, people only think of income tax. They don't think of payroll taxes or sales taxes or excise taxes or property taxes. And so it seems to me that one thing we could do is help people understand the broad range of ways we're already contributing to make the world a better place, to make people healthier. How do you think that we should be talking about taxes? Is that something that you would expect to hear out of the mouth of a public health person?
Well, I think it's tricky sometimes because we have such negative stigma associated with taxes in this country, and that's part of the reason that we're trying to change the narrative around taxes. But the fact of the matter is that in public health, we recognize that we have to invest in the social determinants of health. In our day-to-day practices, we can't just use our traditional medical model approaches, which are trying to work with individuals to change their behaviors or trying to get them into services. We have to look at the broader impacts that we can have on the society at large. And one of those impacts that we can have is through tax policy. And so when you're working in a public health department, you have to recognize that you have a role to play in trying to shape that policy. And before, any of you poor public health people freak out and think, oh my God, I have to do that too. We always say that you have to do this in concert with others. Public health brings an expertise to these kinds of conversations about, for instance, housing policy or education policy or criminal justice policy and tax policy, because tax policy is essentially those investments that help all of those other policies prosper. And public health can bring both the public health approach, which is looking for root causes and trying to find common drivers or determinants of adverse outcomes across a number of different domains, and also showing how those things impact health.
Right.
Because most people don't understand that health is impacted by all of these, determinants. And so we think of health as health care, and public health can bring a much broader understanding of health.
Right. So I agree with you, but I want to push you a little bit, because I do think there's people out in public health land who are thinking, wait a minute, I know I wasn't trained for this. That's not what my public health training prepared me to do. So what could make it easier for people in public health to do this, to make those kinds of connections? What kind of support do they need?
Well, one of the things that I think we should do in public health is train ourselves. It is
okay.
We're lifelong learners. So, I went to medical school, I went to law school, and I still feel like when I'm engaging in some of these issues, I just don't know enough. So I read.
I'm not going to law school, Tony.
You should try it. It's fun. But I think one of the things we can do is continue to educate ourselves and to have, bring people that do housing policy or land use policy into your health department, have conversations with them. In Alameda County, we did a lot of that. We wrote joint reports with other sectors so that we understood their way of sort of seeing the world and they understood ours. And what we found is one of the biggest barriers is we use different languages. Once you can break down that language, you're talking oftentimes about some of the same fundamental drivers.
Right.
So I think it is important to sort of expose ourselves in public health to other disciplines and sectors. And public health is actually pretty good at doing that.
Yes.
The other thing I think that we need to do is to simplify how we talk about health. So people see their work in our work. So it doesn't seem so foreign to others.
I like that a lot. So I'm going to turn and see if we have any questions from the people who are, the hordes of public health people who are watching us have this nice, intimate conversation.
Hello, hordes.
So I have a couple questions here, and I want to, so I'll ask you these and then I'll go on to the other questions I have. One is, what do you say, I mean, all this makes sense to me, of course, and because I think you're brilliant and I think the way you're approaching this is just right, and I'd like to see a lot of public health take this approach, which is why we're having this conversation. But what do you say when people object, when they say taxes are a burden or taxes are too high, that sort of thing, where you get the that kind of negative narrative about what taxes are. What's your response?
Well, I'm not going to lie. I just did my taxes. Wasn't that much fun. And I like to think of, being a contributing member of society and paying my fair share. But I think that one of the things that helps me pay taxes, and I think that we need to think about changing the narrative around taxes, is the recognition that, first of all, we're a relatively lightly taxed country compared to the rest of the world. So we don't have a highly burdensome, tax system in this country. And the countries that actually have the best overall health tend to have the strongest so-called social compacts. They invest in those things that they know that most people will need at some point in their lives: universal health care, child care, paid leave. They don't have mass incarceration systems. They have ways of people optimizing their democratic participation by being able to vote without onerous burdens to get to register to vote. So those countries invest heavily in essentially the things that we all need to navigate opportunity in our lives, and as a consequence, they have better health. When you look at how we spend our money, we tend to spend our money downstream. When you look at per capita spending on health care plus per capita spending on social services, we actually don't spend more or less than most other developed countries. We're kind of in the middle. We just have our money spent disproportionately downstream.
Right.
And the evidence suggests that if you spend downstream, you get poor returns. You've got to spend upstream. And so that's what taxes do. They fund a robust social compact. And so even if you have philosophical reasons for not liking taxes, you have to look at the public health data from the rest of the world that suggests that a well-constructed social compact that's funded by tax investments pays dividends in much healthier populations. And that's classic public health.
Yeah. And there's research in this country as well that comes from Vanessa Williamson at the Brookings Institute. And what she finds is, among other researchers, but she finds that people feel civic pride when they pay their taxes, like when you did that and signed your name there. You're contributing to something. You're part of something. And that connections turns out to be very important to people, despite this floating narrative we have about taxes. And I think you're introducing a concept here. I thought social determinants of health was going to be enough to define. But even though you've talked about it a little bit, define for us what you mean by social compact.
Okay, well, the social compact is a very old term that goes back to Rousseau and Locke and,
I said I don't want to go to law school, Tom.
Philosophers.
All right, okay.
It's also the central concept in the American Declaration of Independence, which is this notion that government, unlike the monarchy, which we were throwing off, government is by our consent. And so our consent goes to those who are governing us as long as they govern in a way that essentially enhances our well-being and happiness. And once they stop doing that, we reserve the right to overthrow them. That's basically what a social compact is. So a social compact is essentially those promises that the governing entities make to the governed, that we will invest in your well-being and your happiness. And so a social compact are those kinds of investments: universal health care, child care, paid leave, a whole host of things that other Western developed democracies invest in as part of a package, recognizing that these are things that people need as essentially a promise to the governed.
And so, in essence, then, our taxes are just the mechanism to deliver on a promise that we have.
Absolutely. And there's also this intergenerational aspect of that compact, that we will invest in the next generation. And, our well-being essentially needs to be protected by investing in them, because they will support us at some point. So there is this notion that it's not just for us, it's for the next generation. And in California in particular, we're working on trying to develop a new social compact for the 21st century, because we believe that the narrative in California is that we all matter and we all do better when we all do better. So California, I think, is leading the way in the rest of the country to show what a intergenerational social compact looks like for the 21st century.
That's good. I'm glad to be in California with you. I think we can infect the rest of the country with this as well. I have another question from, I don't know if it's Hortz, but from the people who are listening in on our conversation. So this is a good question for you, Tony, because you have had experience both inside and outside of government. And so with this question, with that in mind, how can we boost the confidence in the ability of government to spend our taxes in a productive and responsible way?
Well, I think one of the things we can do is tell stories of when government really worked well. We know that post-World War II, when America was rebuilding Europe and investing in the United States, we saw some of the biggest growth in our economy, and we saw incredible improvements in our health status. That's been shown. So when government invests in trying to support the middle class and to eliminate poverty, it actually inures to our health. We see better health results. This country has done a good job with the GI Bill, the transcontinental freeway system, investing in a whole host of things that allow the middle class to prosper. And we don't ever question that.
Right.
We know that government can be very effective. There's been an intentional narrative that has been promulgated by some conservatives to try to say the government doesn't work. We want to make it small enough to be able to drown it in the bathtub. And, that argument also splinters solidarity across a wide range of Americans. And we're concerned that that leads to this kind of balkanized attitude about me and mine versus you and yours. And what we need to do is create a sense of ours. And we've done that in this country before. We think we can do it again. We think we're doing it in California today.
I think that's really important. I think that taxes as a mechanism for how we get those expenditures and investments into the things that matter for the public's health is inextricably linked to how we think about government and what government does, and how government is us. It's we. It's not this separate thing. It's a big job to fight that narrative, though, once again, that we somehow feel like we're on the defensive, I think. What would it take to get us on the offense?
Well, I think there's some people view government differently. They don't like remote government. They think the national government is out of their control. And there's actually a lot of evidence that our democracy is quite broken. I mean, when you poll around something like universal health care, you see broad majorities in support of it, yet you can't get the Congress to do anything about it. When you poll on questions of universal background checks for guns, you see that there's huge majorities that are in support of it. The national government can't enact any policy that reflects the will of the people. So we see that there's more trust in local and state government, where people feel they have more control, more input. And we think that to the extent that we can leverage that level of trust, there's a lot of policy that can be done locally and at the state level that actually helps create a social compact. Now, that doesn't mean you write off the federal government. I mean, we have to continue to enhance our democracy and give people a meaningful sense of participation and voice so that they feel seen and heard, so that we can wrest control of the national government back to the people where it belongs.
Right. That's good. And thinking ahead now, say we're successful with all of you watching us out there, and you've decided that understanding more about taxes and public health is a good idea, and you've joined Public Health Awakened, and you're going to
like your button.
Yes, button. I have my button on, Public Health Awakened, where we have tried to articulate what some of this new narrative might be. Say this becomes our public health holiday every year, that tax day is the day that people start to think of public health. What would it take between now and next year to make that happen?
Well, between now and next year.
Well, I want progress between now and next year, and then I want us to, I'll give us, say you're looking back 10 years and say, wow, we had that first conversation about taxes being connected to public health, and now look what's happening.
Well, I think a good way to start is to start where people are. And as I said earlier, people have a higher level of trust of local and state government. And to the extent that public health is local, for public health to work locally on that message of where tax dollars are going locally and how those tax dollars are enhancing people's safety and their food and their water, and services for low-income people and other people, and universal services for everybody in the community. That's a good message to remind people that these are the things that your tax dollars buy you locally. These are the things that government does for you. Government does it well. Government does it efficiently. Government does it better than the private sector on many of these issues. And I think that a year from now, if we had many more of these voices across the country celebrating the efficiency, the effectiveness, and the equity of local government, I think we would be in a better position than we are today.
So give me another sentence or two on the equity of local government. What does that mean?
Well, equity in local government means that there are things that local government does that essentially are universal, but they're targeted towards those that have the greatest need. In other words, it's not equal, it's universal with an eye towards looking at where there's high need to try to essentially give people the support that they need so that they can pursue opportunity.
Great. And local government really has their feet on the ground. They know where that is. They know how to make that happen.
Well, I'm a local government product. I was a public health officer in 2 local governments, and I will have on my tombstone, here lies a public health officer. So I believe that public health is local, and it's one of the most honorable professions there is out there.
Right. And it's supported by taxes.
It's entirely supported by taxes.
So that's one thing that we can keep in mind, that we can remind people about, that we can help them understand that the taxes they're paying when they write that check, actually, there's good reason for that civic pride, and there's good reason for that feeling connection and the interconnection, because that's how we make that possible.
Absolutely. And tax day should be a public health holiday. We celebrate the fact that we come together collectively to express this support for this enterprise we call our society and its investments in the well-being of all of us.
Absolutely. It's the way that we can do together what not one of us can do alone.
Exactly.
So, well, I'm glad to have this conversation with you. I really feel the commitment from you. I feel the commitment from the California Endowment. I want to thank the California Endowment. And I want to see if we have any last questions before we wrap up here, because I know we are soon to wrap up. We have a couple.
All right.
You ready for some more?
Sure.
Okay.
It's tax day. I'm happy.
Okay. So, this is a good question. So this is more a nitty-gritty question for people who really want to put this narrative to work. So one of our viewers wants to know, how do we promote an investment strategy or a divestment strategy that advances health equity without reinforcing this false zero-sum game?
Yeah, I think that's a great question. This scarcity narrative that we have,
right,
that I can only have if I can take from the other,
right,
is a false narrative. First of all, there's a lot of evidence that when we all do well together, particularly when there are deep investments in the well-being of everybody, we all do better. In other words, we grow the pot. So it's not a zero-sum competition between X and Y. Also, we're a very wealthy country, and the way that we allocate our resources right now, without even changing how much we spend,
right,
we could do so much better by shifting to prevention away from this downstream, some would say a punishment kind of approach,
right,
waiting for things to happen and then sort of piling on.
right.
That's very expensive and very inefficient. So even with the same amount of money we have now, which is a lot, by shifting how we invest those resources and putting more emphasis on prevention and anticipating things that all people need, i.e. investments, we can actually all do better. So I think that's the key way of thinking about scarcity versus abundance.
Right. Well, that was a great final question. We're out of time right now, so we have to wrap up. Thank you all for joining us. Thank you for watching it later, if you're watching it later. And please come to publichealthawakened.org if you'd like to learn more about what those of us in public health who are concerned about our social determinants of health, getting the resources that we need to them, and changing this narrative about taxes or trying to do something about it. And join us for the thunderclap right after with hashtag taxes make health happen. Thank you. Thank you, Tony.
Happy Tax Day.
Happy Tax Day.